I'm Jaylin Chen. Welcome back. In the previous session, we talked about urinary elimination and some selective problems. When all measures to initiate voiding fail, urinary catheterization may be necessary to empty the bladder. So, how to perform urinary catheterization is our topic for today. Here are the learning objectives. By the end of this session, students should be able to identify different types of urinary catheters, describe the guidelines for catheter selection, understand the aims of the procedure, and verbalize the steps used during the procedure. Urinary catheterization is the introduction of a catheter into the urinary bladder. Catheters are commonly made of rubber or plastics. Urinary catheter may be made from latex, silicone, or PVC. They are sized by the diameter of the lumen using the French scale. The larger the number, the larger the lumen. 1 French is equivalent to 0.3 milliliter. There are straight catheter and retention catheter. Straight catheter is a single lumen tube, inserted to decompress or empty the bladder, and then removed immediately. It is used for intermittent catheterization, measuring the amount of residual urine, or obtaining a one-time urine specimen. Retention or indwelling catheter, also known as Foley catheter, is a double lumen catheter. The larger lumen drains urine from the bladder, while the smaller one is used to inflate a balloon near the tip of the catheter. The purpose of the balloon is to hold the catheter in place within the bladder. It is important to follow the manufacturer's instructions for the proper volume of sterile water for balloon inflation. We should use a retention catheter if the bladder must remain empty, or continuous urine measurements or collection is needed. The 3-way or triple lumen catheter has an additional opening. It is often used for continuous or intermittent bladder irrigation or introducing drugs through this 3rd lumen. How to select the appropriate type and size of catheter, you may ask? Let's go through the guidelines of catheter selection. First, choose the type of material according to the estimated duration that the catheter will remain in place. Second, determine the appropriate catheter length by the patient's gender. For example, use a 22 cm catheter for females, while a 40 cm one for males. Do you know why? You will find the answer later. Third, determine the suitable catheter size by the size of the urethral canal. Here is a list of different sizes of catheters used in men, women, children, and infants. Just remember, use the smallest possible catheter size that is consistent with proper drainage to minimize urethral trauma. And the last step is to select the appropriate balloon size. Let's now discuss the urinary catheterization for females and males using straight and retention catheters. Remember, this is usually performed only when absolutely necessary, because of the risk of introducing pathogens into the bladder, ureters, and kidneys. So, strict sterile technique is very important. Potential hazard is the trauma associated with urethral catheterization, particularly in the male patients. They have longer and more tortuous urethra, and inserting a catheter along its normal contour is essential. Well, let's talk about the aims of inserting a urinary catheter: to relieve discomforts or provide gradual decompression of a distended bladder, assisted in clinical diagnosis, introduce drugs, measure urine outputs for critically ill patients, empty the bladder completely prior to surgery, prevent urine from contacting an incision after perineal surgery, provide a conduit for bladder drainage or irrigation, and manage incontinence when other measures have failed. Before catheter insertion, we need a lot of preparation work. Let's start with the assessment part. First of all, check the patient's identity according to institutional protocol. Review patient's history and physical assessment data, physician orders, and nurse's notes. Determine the most appropriate method of catheterization based on the purpose and any criteria specified in the order. Then select the ideal catheter according to the guidelines. Assess the patient's overall condition, including current health status, level of awareness, mobility and physical limitations, any existing urinary system diseases, self-care ability, time of last urination or catheterization, and history of allergy to medication, tapes, and latex. Determine if the patient is able to cooperate with positioning and tolerate the procedure. Check the patient's bladder for distension. After the assessment, we will proceed with planning for the procedure. We need to explain the purpose, procedure, benefits, risks, and complications to the patient. The patient may be instructed to perform perineal hygiene if he or she is able to do self-care. The nurse should perform hand hygiene and observe appropriate infection control measures. Provide privacy to promote and maintain patient's dignity and ensure adequate lighting. What equipment do we need to perform urinary catheterization? Let's take a look. Top of the treatment cart: a catheterization kit, tape, pin, label sticker, disposable waterproof sheets, bath towel, and hand sanitizer. A catheterization kit contains supplies for preliminary disinfection and an independent inner package. The inner package includes supplies for repeat disinfection, and other supplies for the procedure. Bottom of the cart: bedpan, domestic waste bin, clinical waste bin, a screen if needed. Supplies for preliminary disinfection include the following items: sterile glove, receptacle, antiseptic cotton balls, forceps, and sterile gauzes. The independent inner package includes the following items: kidney dish, sterile gloves, sterile drape, antiseptic cotton balls, sterile gauzes, forceps, fenestrated drape, cotton balls with lubricant, Foley catheter, Jade catheter if needed. Syringe pre-filled with sterile water in the amount specified by catheter manufacturer. Urine drainage tube and bag, specimen container. In this session, we talked about different types of urinary catheters, including straight catheter, indwelling catheter, and three-way catheter. The guidelines for catheter selection from the aspects of type of material, catheter length and size, and balloon size. The aims of the procedure, and the assessment and planning, including equipment preparation for the procedure. In the next session, we will continue to go through the implementation and evaluation parts. Here are the references. Thank you for joining us. See you next time.